talking about something very important, and it is related to women's health and their reproductive systems and their organs. So women these days, or I think it is from a long time, they don't care much when it comes to their health. They kind of delay it as much as they can, and that can be dangerous because they are not even aware of the symptoms what they are getting into, and they're considered a taboo. So Shahzad, we are discussing this topic today, and this is going to be very informative, and we're very lucky here that we are joined by...
We have been joined by somebody who happens to be a consultant gynecologist, ladies and gentlemen, from Maroof Hospital. She happens to be Dr. Irum Yasir. Hello, assalamu alaikum, good morning, how are you?
I'm fine, thank you. Walaikum assalam.
Thank you very much for joining us. It's wonderful to have you over here and to talk about such a topic which obviously not many people kind of talk about very openly, and we over here at PTV will certainly make sure that we kind of touch upon each and every topic which we feel that people are not touching upon. Now, first things first, obviously, you know, we actually just passed a very rough 2 years where it was COVID. There was an increase in miscarriages. There were a lot of other problems related to women being pregnant as well. So what were the most common issues which we have faced in the past 2 years? What are the most common issues anyways? And then we will get into the reasons of these very common issues as well. Please go ahead.
First of all, thank you so much for providing me such a great platform to discuss all the women health issues. I would like to commend that women health issues are related to physical and mental issues related to COVID-19. In the recent last 2 years, we have faced many problems related to female, their health problems, reproductive issues. Most of the females, they were conceiving in these 2 to 3 years because whatever they were not doing was going out and having something entertaining for them, and they were just living inside their houses, and this was one of the factors making them more depressed and eating more, and this lead to many physical and health disorders. जो चीज़ हमने ज़्यादा face की उसमें ये था कि females जिन्होंने conceive किया, they were depressed and they were eating too much, they were obese, they were not having healthy lifestyles, like उन्होंने exercise बिल्कुल छोड़ दी जो routine में थोड़ा बहुत कर रही थी, या वो diet control जो वो routine में low carb diet या proteins ले रहे थे, they reduced that and they started taking oily fatty food. They were making more food with curries and oily stuff, and they were eating that. In these cases, normally the level of miscarriages, rate of miscarriages increases automatically. And COVID being a very different sort of infection, उसके implications जो कि हमें last 2 years में पता चले, क्योंकि पहले तो ये था ही नहीं COVID. तो different complications थे, हर एक female में different complications थे. Few had miscarriages, few had preterm deliveries. Few had oligohydramnios, which we label as a level of amniotic fluid reduces around the baby. And very few people, they were very concerned that why should we go for immunization, should we get vaccinated or not. Many people, they were not getting vaccinated. That was one of the cause that was increasing the maternal mortality rate also. So
and we would certainly want to pick up on that as well, but before we do that, you know, just very quickly, you know, because this popped up in my head as well, because what I've witnessed so far, it might be a very generic statement to say out loud, but ladies and gentlemen, obviously, you know, people from different walks of life will have a very different experience. Now imagine for 2 years everybody was at home, nobody was allowed to go outside. So rather than having healthier food, home cooked food, you know, we kind of relied on keto diet and, you know, intermittent fasting and whatnot. And these is, I don't know, I think within the urban sphere, what I've seen is that women are not very willing to be pregnant in the first place, because everybody wants to kind of look slimmer and fit and whatnot. And this has to do quite a lot with your mental health as well, because God forbid, you know, if you do not feel nice about your own body, you know, you might not even feel right in your head as well. So why do you think that there's been this shift where all of these problems have actually caused a lot of premature babies' their life as well? And in addition to that, how do you think that, you know, you're going to refer to women that, hey, you know what, start eating healthier, make sure that you have your rotis, you have your carbs, you have your fiber, so that there's more energy in you if you are to kind of make sure that you're going to give birth to a baby as well. Please go ahead.
Actually, first of all, we should have awareness programs for ladies, their reproductive health, contraception, and their dietary counseling. Whatever the girls are doing these days, even the girl of 10 or 12 years is having a weight of 80 kgs.
Yes, exactly.
Because she's eating junk and she's not working out, not even moving from the bed. Especially
that is even creating hormonal issues, I think, and that is a very alarming issue.
Actually, the online classes, you know, initially students used to get up in the morning, they used to go to the school for 2 to 3 hours. They used to play with their friends in the playground and football and whatever. But now all the girls and boys, they're totally sitting on the sofa and couch and having the iPads in front of them, and they're just having chit chat with their friends.
So that's creating more problems.
Yeah, and related to this reproductive health, many of the females, they are not aware that they are pregnant, because we have very few people who are educated. Most of our population in Pakistan even is uneducated. The females who are getting pregnant, they even don't know they are pregnant. They usually come to us that we're not having periods for last few months. When we get to know and we do the investigation, we tell them that you are pregnant. And they had COVID for last 2 to 3 months, and all the complications of COVID have already been present in those females. That the baby was IUGR, their growth was restricted, and their AFI was reduced. So it was difficult to manage those patients. Even some of the patients were coming to us that they were not able to breathe. We had to put them on ventilator, and they were mostly on this in the 7th or 8th month of pregnancy. So at that stage, it was very difficult for us, and it was very challenging to save the baby and the mother, to deal with 2 lives at the same time. It was very tough time for us.
Yeah, it's very. Now, Dr. Saab, you were talking about the education, females who are ignorant, or the, literacy rate is really low. Even there's a notion in women who know kind of everything, but they're going through something where they will not go to the doctor or ask them. Why is that happening? Why are they not very open? I mean, the kind of era that we're living in.
You're right. Most of the females, when they come to me in the OPD, and when I discuss with them, they are not even open to me. I have to make them be comfortable with me and discuss with me the problems, because I am the one who's going to help you out. After that, many of the females, they told me that they have got the periods problem, they have got irregular bleeding disorders that is causing their quality of life to be disturbed, and they're unable to do basic household things, because this reduces their HB hemoglobin levels. And with anemia, it is very difficult to deal with all the household works. So I think like See a Breast, we have awareness programs in October. So we should create some women health related programs related to bleeding and infections. So we can provide a platform to the doctors to discuss openly with all the patients, and we should get some calls and some free camping system to educate the females regarding the bleeding disorders, infections, and whatever physical or mental health problems females can face.
And that it's okay to talk about it with your doctor. I mean, we're not actually kind of saying that you really need to go out to your cousins or, to your sisters and, kind of talk about it. Why don't you go to a doctor and, talk about it with your doctor?
Trust them.
I think that's very important. But in addition to that, I think there's one more thing, and that is that Pakistan, at least as of today, we are on the 5th or 6th number in being most populated. Which obviously means that, I think our emphasis most of the time is on reproducing anyways. And, if somebody has got 3 daughters or 4 daughters, he's still trying for a son. And unfortunately, what they kind of undermine, or what they kind of do not value, is that they kind of do not consider that it's very important for their wives to be healthy, to kind of reproduce and, go all over that process again. How do you think that we really need to educate men that, hey, you know what, you kind of really need to consider your wife's health in the first place, and then think about having more babies? Because your family is from your wife, ladies and gentlemen. Please make sure that you understand that. God forbid, if you're not kind of going to pay attention towards that, unfortunately, you might not even have a family member. So what's the point? Please go ahead. Let's talk about that as well.
This is all about contraception. And most of the times we're counseling the female only, not as a couple. So whenever we are counseling, we are talking to a female, we should talk like a couple. We should invite the couples, their husbunds, to come along with them.
Who do not show up anyways.
So they're reluctant. Why is that?
Even at the time of delivery, most of the husbands are near there. But to be honest,
why would you say mother-in-law? She said something really very sweet. Let's see what her answer will be.
So because this is what happens in the hospital.
Because the mother-in-law really needs to see whether it's a daughter or a son. Are you referring to that?
Yeah, well, that as well, and that's what happens normally in the hospitals. You go to that department, and you would not see husbands mostly. Well, I don't know about the trend now, but I think.
I hope your mother-in-law is not watching.
It's okay. If she watches, she knows what kind of trends we are having here in Pakistan.
Was she at the hospital?
I'm really sorry to interrupt. Once I had a patient, and I was planning to deliver the patient because her fetal movements were really reduced, AFI was reduced, growth was not fine. So I discussed with the female that we need to have your husband here, and I'll discuss that we have to plan delivery right now. Then what she said that my husband is not there, but my mother is loyal. Is it?
See, you can prove my point.
You know, it's because of the fact that, that the husband really cannot look after a newborn baby.
Well,
you know, it's so difficult to pick up that newborn baby.
Obviously,
that's not a justification. I was always there when my daughters were born.
I'm so glad.
There's no point that I'm going to talk about. But there's one more.
Sometimes the husband is so nice. They're literally crying outside the labor room.
That is
and make me feel jealous.
That is so sweet.
But there's one more question, and that is that this is something which I've gone through myself. Now imagine that, you know, for the previous 9 months, you're going to your gynecologist, everything's fine, everything's superb, you know, your delivery is going to be on time. You go on to that delivery day, and then, you know, all of a sudden you see a nurse rushing out of the procedure room and be like, "Sir, masla ho gaya, bada masla ho gaya. The umbilical cord is just around the neck of your baby. We really need to go for an operation."
Yes,
and, you know, at that point of time, I was like, you know what, for the last 9 months you've been telling me everything is fine, and all of a sudden you've started to rush and be like, yeah, you know, we need to operate it. What other solution do you give me?
And
you know,
that is not even clinically justified if you go to the other doctor.
And I'm sorry, at times...
Yes, that's what's happening.
I'm sorry, at times, you know, that might be necessary and that might really be the case. But I am not going to agree 100% that 100% of the time...
I'm also not agreeing 100%.
Sorry, जैसे हम कहते हैं ना, जिसका काम उसी को साझे. Actually, होता ही है कि when we are watching a patient throughout antenatal for 9 months, we don't know, we never can assume that she's going to deliver normally, or we will have to do cesarean section for that female. But there are certain things we have to assess at 38 weeks. जब हम कहते हैं 9 months हो गए हैं, तो we have to assess certain things at that time. That what's the position of the baby, whether it's cephalic, means head niche, whether it's breech, mean it's a normal presentation to deliver vaginally, and whether the female's blood sugar levels are fine, blood pressure is fine, hemoglobin level is fine, female is totally ready to deliver vaginally. So we have to assess. Even when we induce the patient, or when the female is in labor, even at that time we are not sure what's going to happen. We continue the monitoring, fetal monitoring and maternal monitoring. We have further parameters for that, CTG, and we attach cuff for blood pressure to the female, and we are just keep on monitoring both. But at few points, when the fetal heart rate it reduces, even at that time, हम उसको assess करते हैं, hydrate करते हैं, oxygen देते हैं, repeat karte hain. But there are few parameters then when we have to decide that this is not going to deliver vaginally.
Dr. Saab, that's well taken, this point, but still there are these doctors in the markets who are actually famous for that. I've seen, you know, there are patients that have switched from one doctor to the other, saying the same towards the, you know, last term. So why is that, and what can we do about that? It's something very important.
How do we as parents, or, you know, as family members, can keep an eye onto those people who might be
doctors like
involved in this ill planning?
No, you're right. Actually, what I do with my patients is that I counsel my patient throughout the antenatal visits. मैं उनको बताती हूँ कि we will 100% try to deliver you vaginally, but we never know. God knows better. For 5 to 10% of the cases, we may lead to cesarean section. In that cases, I think the most important thing is interacting with the female, taking them in your confidence. They should be so comfortable with you that even if you are going to decide for cesarean, they should be satisfied. I think.
And there's no confidence left, you know, when somebody comes running towards you and be like, "Sir, the umbilical cord is around the neck of the baby." You're like, okay, what other options do I have? Sir, we have to operate. Okay, operate. But okay, very quickly towards the end of this segment, what I would certainly want to ask you is that, you know, for all of those women who are out there, you know, our mothers, sisters, everybody who's out there and who are planning to have a family, what kind of dietary habits do you think that they should have on regular basis so that they are healthy mothers?
For women being healthy, we should concentrate on both physical and mental health. For physical health, they should do proper exercise, daily walk, not even running, then a little walk. Dietary modifications, they should take mostly proteins, low carbs, vegetables, fruits, nuts, like this. And they should be taking some time for themselves, for their physical fitness, you know, some time to breathe out. उनको अंदाजा ही नहीं होता कि हम सारा दिन काम करती रही हैं.
Their me time.
Me time, exactly. At least 10 to 15 minutes me time without everyone else.
And I believe in today's time, 10 to 15 minutes is not enough. You know, you at least need an hour to yourself. You know, probably read a book, you know, watch something on TV or probably on your cell phone. And just relax, just be with yourself. I think that's what is very important. But thank you very much, Miss Consultant Gynecologist Dr. Irum Yasir, for being with us. Wonderful to be in conversation. And for everybody who's out there, ladies and gentlemen, every single day, you know, what we initiate is to kind of make sure that we reach out to you with a lot of knowledge and research so that, you know, it's going to benefit you for the rest of your life. And let's get into that.